So, you're an international medical graduate here in Australia, and you're probably feeling like you're at a major crossroads, right? Well, in this explainer, we're going to cut through all that confusion and lay out a really clear, strategic roadmap for your career. Let's dive right in.
This is the big question, isn't it? You've spent years, so much effort getting your medical degree, your MBBS. But the path to actually practicing as a doctor in Australia, it's complicated. It's not immediate. So what do you do now? Where do you channel all that incredible expertise you've worked so hard to build?
The first instinct to get more education is a good one, for sure. But it immediately brings up a huge question. What kind of education? This is a critical decision, and honestly, a lot of people take a path that ends up being a strategic mistake. A Master of Business Administration, an MBA. It often seems like the logical choice. It's prestigious, everyone knows what it is. But here's the thing. For someone with a medical degree, a generic MBA can actually water down your greatest strength. It kind of turns you into a generalist when you have this amazing specialist background. It becomes a detour instead of a launchpad for your career. And when you put them side by side, the difference is just crystal clear. With a generic MBA, you're suddenly thrown into this giant pool, competing against everyone from every background, and your medical knowledge just becomes a little side note on your resume. But with a specialized healthcare master's, your MBBS is your superpower. It gives you instant relevance, plugs you directly into a super high-demand sector, and honestly, gives you a much, much clearer path to a great career and permanent residency.
Okay, so if a standard MBA is off the table, what are the direct routes to success? Well, our analysis points to two really powerful specialized pathways that are pretty much perfectly designed to leverage that medical degree of yours. Let's break them down.
So pathway number one is healthcare management. The best way to think about this is you become the operational brain of a healthcare facility. You're not the one diagnosing patients anymore, but you are the one making sure the entire system, the hospital, the clinic, whatever it is, runs like a well-oiled machine. You get to combine your clinical know-how with business strategy to manage people, money, and the big picture.
In the second pathway, health informatics. This is where medicine smashes right into the digital age. Healthcare is moving so fast from paper to digital, and there's this massive, growing need for people who get both the clinical side and the tech side. You'd be the person managing patient data, rolling out new health tech, and using all that information to actually improve how we care for patients. It's pretty cool stuff.
So this brings us to a really clear choice. On one hand, you've got healthcare management. That's a path defined by really stable, consistent demand for core leadership roles. And on the other hand, you have health informatics, a super fast-growing, tech-driven field where if you've got analytical skills, you can often command a higher starting salary. Both are fantastic options that build directly on the foundation you already have. Okay, let's talk about the bottom line. What do these careers actually look like when it comes to salary and your return on investment? Because this is often the deciding factor, right? So let's get into the numbers. Just take a second and let that number sink in. Over $180,000. This isn't some fantasy number. It represents the real high-end annual salary for a senior health services manager in Australia. This is a tangible, hiring career that is absolutely within your reach. And it's not just that one specific role either. The data shows strong earning potential all over the place. I mean, look at this quote from my salary calculator. It shows that even for health program managers, a six-figure salary is the standard, not the exception. The financial side of this is really, really solid. But what about the return on that investment? A 2-year master's program, when you factor in all the costs, might be around $130,000. But look at this, a single year's salary in a mid-career role can be more than that entire amount. The ROI is just incredibly powerful. You could pay off your degree in just a few years of working. Now, of course, it's not some guaranteed golden ticket. To give you the full picture, we have to be honest about the hurdles you're definitely going to face along the way. First off, the competition for the best jobs is high. Second, and this is a big one, employers in Australia really value local work experience. You absolutely need a strategy to get that foot in the door. And finally, and this is so important to remember, these are management and data jobs. They are not a backdoor to becoming a clinical doctor in Australia. So with those realities in mind, let's talk about the ultimate goal for so many people, permanent residency. The great news is that these career paths provide a very clear, very strategic bridge to get you there. The whole visa journey can seem so intimidating, but it's really just a logical sequence of steps. Step 1. After your master's, you get a post-study work visa. This is your ticket to getting that all-important Australian experience. Step 2.
You go out and work in your field. And step 3, you leverage all that great experience to apply for a skilled visa. See? It's a clear, step-by-step process. And here's a key reason this strategy is so powerful. The very job titles we've been talking about, Health Services Manager, Health Information Manager, they are often on Australia's skilled occupation lists. And here's a pro tip. Getting employer sponsorship or a state nomination can dramatically, and I mean dramatically, boost your chances of success.
So we've covered the why, the what, and the how. Let's pull it all together into one final strategic action plan that you can start thinking about today.
All right, here is your mission. First, choose the right tool for the job. That's specialized masters. Second, get obsessed with gaining that crucial local experience through internships or grad roles. Third, target the right employers. Think hospitals, aged care, private clinics, and health tech companies. And finally, never stop building your technical skills, especially with data and IT, because that's what will make you absolutely indispensable.
And that brings us to the final and really the most important question. And this one's for you to think about. Based on everything we've just covered, where do your real strengths and passions lie? Do you see yourself as a systems leader, orchestrating the people and processes that make healthcare work? Or are you a data pioneer, using technology to shape the future of medicine? The choice is all yours.